Hi, I'm Claire Murphy and welcome to Well. Australian women, this is your full body health check. I've been a journalist for nearly 20 years, the past 6 of those hosting Mamamia's daily news podcast, The Quickie. So I've asked a lot of questions of a lot of experts about a lot of things related to women's health. But now I want to know more.
And my name's Dr. Mariam. I'm a Sydney-based GP and a staunch advocate for all things women's health. So think of me as the women's health BFF that you never knew you needed.
Straight up, let us tell you why we're here. Well is about addressing the taboo, the annoying, the embarrassing, and sometimes the scary. We're going to cover concerns that you're probably considering seeing a doctor about, from insomnia to weird periods to how to prevent dementia. The difference is we're going to give you the tools that you need to make sure that you are seen and heard by your healthcare professionals, and we won't charge you once your 15 minutes is up. We'll ask the questions that you might have felt maybe a bit apprehensive to bring up and speak to specialists when we need their expertise too. Today, we're putting a spotlight on periods and we'll be answering a question from Elise, who asked us about a certain smell. But first, we're going to med school.
Welcome to med school.
So in making this podcast, we've learned a stack of very cool and sometimes crazy things about our bodies, some things we can never unlearn. So this is where I'm going to share something that I found out recently, which will equal parts freak you out and fascinate you. Ladies, have you heard about the sperm graveyard? Now, look, I came across this on my social media feed of a doctor in the US, which explained apparently the sperm that is ejaculated inside of you, obviously when your partner is not wearing a condom, and which does not end up fertilizing the egg, which is millions of them.
Mm-hmm.
Mariam, can you please explain to us where they go?
So when a man ejaculates, it's thought that 200 to 300 million sperm enter the vagina. That's a lot of sperm.
That's a lot.
And I like to think of the vagina as like the ultimate ninja warrior course, right? It's designed with lots of boogie traps to kind of kill the sperm before it gets to the egg.
Oh, so we're not welcoming it in
we're not
at all.
The vagina's not very welcoming. So there's things that the sperm has to get through, like the pH. So a lot of the acidity of the vagina will kill the sperm. There's the cervical mucus in which some of the sperm will get trapped in. And then the body identifies the sperm, and rightly so, as foreign invaders. So we'll send these white cells to kind of shoot them away. And then for the sperm that does make it through the fallopian tube, and at this stage that's thought to be about 200. So you can imagine 200 to 300 million, and you've got 200 sperm remaining. The rest have just died from exhaustion because sperm is quite lazy.
That does not surprise me in the slightest.
So the sperm's traveling along. One, we hope, will fertilize the egg, and then the rest are thought to just keep swimming along. And so the fallopian tube is actually not attached to the ovary. So there's these like finger-like projections called the fimbriae. And so it can actually exit out of the fallopian tube into your abdominal cavity.
And this is what I've heard is referred to as the sperm graveyard.
That's right. So if you have a visual, you can just imagine this sperm just falling into your abdominal cavity, but do not be alarmed. Enzymes break that sperm down and it's reabsorbed for nutrients for the body. Yeah.
I'm almost a little bit okay, so they had to go through quite a bit to get to this point. So it's almost okay,
yeah,
you made it.
Yeah.
All right for being there. But there's a part of me I didn't welcome you into my abdominal cavity. No.
Yeah.
Gross.
Yeah.
Go back.
Yeah. Well, you've pretty much been really unwelcoming from the start if you think about it.
I love that. So our vaginas are you're not welcome here. And they're damn straight I'm going in. And then they just keep on going until eventually we absorb it. What happens after we absorb it? Are we using that for something? Yeah,
but if you think about it, sperm is microscopic. You can't even see it. So it's so tiny.
But you know it's there.
Yeah, I know. And now it's the knowing. Now everybody knows.
Now everybody knows.
Now everybody knows.
Sorry, everyone. This is going to happen as we do this because as I come across things, I'm going to start sharing them. And if I have to know them, then you have to know them too. So sorry. The fun part, though, is going to be when you have to go and tell your mates now because you'll be sharing the things that we didn't know that we had to know. Good luck to them.
Fun times ahead.
Fun times ahead. And we are going to actually put that video of the sperm graveyard up on our socials too. So if you want to go and check it out. We're going to be finding out some more about Elise and her smelly concern soon. But next, you and I, Mariam, we're going to do some period myth busting.
Let's do it.
Because even though we think we know everything about our menstrual cycle, trust me, we do not.
It's time for the checkup.
All right, let's do some period myth busting.
Okay, let's do it.
Because these are things that are questions that I asked of both myself and the people around me.
Mm-hmm.
What are some signs that your period might not be, and we put this in quotations, normal, because normal is different for a lot of people, right?
Yeah, that's right. So what would not be normal is you've noticed a change in the pattern of your period. So it's starting to become more erratic, it's irregular, you're bleeding in between your periods, you're bleeding for a prolonged time, for more than 8 days, you're bleeding after sex, or there's significant pain with your period that's not being relieved with simple over-the-counter medications and it's disrupting your quality of life, or you're just concerned for any reason about your period. That's more than enough reason to see a doctor.
Can you explain all the different cycles of the month, not just the menstrual cycle? Because, you know, apparently us getting just a week off of being in some kind of state as a woman is not a thing. Can you just take us through like where we're at each part of the cycle?
The menstrual cycle is like a monthly occurrence. Essentially, your body's preparing for a potential pregnancy. Starts from day one of your period and finishes the day before your next period. Essentially, there's 4 phases. The first being menstruation, which is when your endometrial lining, that tissue is shedding and
like escaping the body.
Yeah.
Fun.
So, you know, a pregnancy hasn't happened and then you're bleeding. And, you know, for most people that will last 3 to 7 days and it is no fun. And then following menstruation, you enter the follicular phase. And this is where simply the ovaries release all these follicles, one of which will become the mature egg, and that endometrial lining starts to thicken to prepare for pregnancy. Your hormones start to rise during this cycle.
And are we happy in the
so
follicular stage?
We're probably like normal level. This is our normal self.
This is where we can like get a baseline.
Yeah, this is our baseline, yeah. Then we reach ovulation, and ovulation is when your estrogen peaks, you're feeling your best, and this is when one of those follicles will become that mature egg, and this is when you're most likely to get pregnant. So if you have unprotected sex during this period, you're going to have a baby.
And this is when we actually find our partners attractive, less annoying.
Yeah, I know, the only time. No, I'm joking, babe, I love you. And then after ovulation, we enter the luteal phase. So this is where you get like a progesterone rise and fall. And the fall is essentially when we realize, there's no sperm, no baby. And so the progesterone drops, and that's when that endometrion's like, okay, I'm going to start to like, you know, slow and come
And are we getting angry here?
So this is when your PMS and your PMDD symptoms start to kind of make an appearance. I hate this part of the cycle. So
because this is when my husband breathes too loud.
Yeah. Mm-hmm. Yeah. This is when my husband leaves the country. Yeah. And then you bleed and starts again.
Start all over again.
Starts again until menopause.
How much blood is normal? Because I switched from using tampons to using a menstrual cup, and now I can see exactly how much comes out, but I've been told that is not all menstrual blood. There's like other fluids in there as well, but it seems like a heck of a lot more than what I've been told is like a standard period flow.
So there's much variability, obviously, with what females will experience with their period, but you know, the average loss is thought to be about 30 to 40 mils, which is 6 to 8 teaspoonfuls.
Why are we measuring in teaspoonfuls? Can we not measure via menstrual cup or something? Like at least something we're using?
It's
like
a bit,
no one's poised over the loo with a teaspoon.
But we define heavy menstrual bleeding as any bleeding that impacts your quality of life in any way. So if you feel like, you know, you're having to change your pads or tampon every hour, you're leaking through, your period's more than 8 days, you're passing large clots, which we say more than a 50-cent piece, then there's signs that something's happening. You should see a doctor. Okay. Yeah.
What are my options if I do have, or I'm prone to having really heavy periods? Because like there's maintaining it with as many pads and tampons and menstrual cups as you can, but are there other things that we can do?
Yeah, definitely. So if you do have heavy periods, I would really encourage you to speak to your doctor, because there could be underlying causes contributing to the heavy periods. We also want to ensure that you don't have iron deficiency as a consequence of the heavy menstrual bleeding as well, which is awful. I get iron deficiency all the time. time.
I feel like everyone I know now has an iron deficiency.
Yeah. So, and I always say, like, iron supplements and iron infusions, they're kind of Band-Aid solutions. So you want to kind of address the root cause. And if that's heavy menstrual bleeding, then figuring out why you're having it and stopping it from happening is really important. So the first thing to do is definitely see a doctor, and get the appropriate investigations. But while that is happening, doctors should be giving you medication if that's something that you want to reduce that blood loss. And there's non-hormonal and hormonal options. The non-hormonal options are something we call tranexamic acid, and that stops the blood from clotting. That's actually quite effective in reducing blood loss. Anti-inflammatories are also shown to reduce blood loss, and they also help with the pain.
Mm-hmm.
You can take the two of them together. They're most effective to start a day or two before your period, and you continue them for about 3 days during your cycle. The hormonal options are, and the first line for all heavy menstrual bleeding is the IUDs. That is 95% effective at 12 months in reducing heavy menstrual bleeding. It's really effective, and it helps like keep that endometrium nice and thin. Then there are the progestin-only pill and combined oral contraceptive pill. They're actually quite effective as well. Obviously, there's side effect profiles and preference to the patient. So that's the options to discuss with your GP on what you would feel would be best suited to your life. And for the patient to have really heavy menstrual bleeding that's affecting their quality of life, they've trialed everything, we've excluded underlying causes, that would warrant a referral to a gynecologist, for more extensive investigations and potential surgical options if that's something that the person wanted to do.
But how much pain is quote unquote normal?
So pain is subjective, right? So what might be painful for me might not be painful for you. But what we do consider normal for periods is, period pain that isn't affecting your quality of life. Generally, you get the peak of the pain in the first 2 days. If you have a bit of pain, you take over-the-counter medications like paracetamol or anti-inflammatories. You're still able to go about your day. It's not impacting your work or extracurricular activities. That's normal. As soon as I am having to take days off work, or, it's impacting relationships, or you're just staying at home lying in bed, that's not normal.
Here's a question.
Mm-hmm.
If things are all happening around my uterus, why do I get pain in my lower back?
So we blame that all on the prostaglandins. So prostaglandins are released during menstruation, and that's what causes the smooth muscle to contract. So the uterus and the spine are in close proximity, so you get that radiation in the pain. We also, like a physiotherapist was telling me that the hormones also loosen your ligaments, which makes you more prone to injury. So, which is really interesting.
That is interesting. Like the Western Bulldogs AFLW team have just started doing something around. So they've customized training around their players' menstrual cycles because of that very fact. And they're wondering if, a lot of their players are getting ACL injuries because of that kind of stuff too.
Yeah.
So that is really interesting.
Yeah. So it's thought maybe it's causing some spinal instability, and that could be a cause of the back pain as well. But importantly, the back pain could also have a root cause. So you might have an underlying condition like endometriosis, fibroids, or adenomyosis, which is causing that referred pain as well. So important if it's quite severe and doesn't feel normal, definitely see a doctor.
Like if you are throwing up from pain.
Yeah, that's not normal.
This is something I'm weirdly fascinated by because sometimes at stages of your period, it's bright red, like red. And sometimes it goes a bit brown, like at the start and the very end. Can you just tell us at what stage these colours should be coming out and why they're different colours?
Yeah, so for every female, it's going to be variable. You can get all shades of red and black and brown. So generally, and you also get the cervical mucus as well. So you'll notice at ovulation, you get that stretchy egg white yolk. You do that little finger test. So people do that for fertility awareness method. Yeah, so some people
they grab some of that mucus between their fingers and stretch it out.
It's a form of contraception. Some people that don't want to use hormonal methods, they it's all based on your temperature and your.
Oh, okay. Yeah, I have heard that.
Yeah.
I didn't realize mucus stretching was a thing, but okay.
So you just put your finger in and just play with your cervical mucus. It's a thing. But yeah, that's how you know when you're at ovulation. And then as you get to your period, you'll find that when you start to bleed, the blood is brighter red, and that's just because it's like fresh blood. It hasn't had a chance to like oxidize with oxygen. And then as you go through your period, you'll get darker colors with clots, and that's because the tissue and blood's been sitting there for a little while and it's oxidized and then it passes. And so you might get darker brown or a near black. So all different shades of red.
Someone told me that, like, you know, when you're putting your details into your period tracking app and you've got to put like the day it starts and the day it ends, and sometimes that's not a clear like end day.
Yeah.
And someone said like when it turns brown, technically that's the end.
Yep. Yeah, so the end is when you stop bleeding, essentially.
Right.
Yeah, so you might have like, you know, we say the last hurrah.
Oh, God, that is such a pain.
Yeah. Essentially, sometimes tissue can get like block the exit, and then you get that uterus contract and then a whole bunch of it will come out. So,
but that happens to me every period.
Yeah.
Like every single time I think it stopped.
So
then like later that day, a last little
it's just like,
along.
ha.
Yeah, it's like, oh, you're going to wear the white pants now, are you? Sucker.
Yeah. So those liners are really handy just in case that happens for an extra day or two. It's pretty annoying, but...
This is something that we've been having a lot of conversations about, especially in the last couple of years, is what period products are actually healthy to use, because there's been a lot of fear around potential chemicals in things like pads and tampons, and then, you know, menstrual cups came along. And so what realistically is healthy? Because I know some of those studies around the heavy metals that were in tampons, the research wasn't done in a way that actually like that those heavy metals would even make it into your body or bloodstream. So it was just a big scary thing that wasn't really a thing. Can you give us some explanation around that?
So I think it's actually been great that this has happened, because there's not a lot of studies on tampons and pads. And
what is wild is that they didn't start using blood on those products until very recently. They've been testing them with fluids, but not actual menstrual blood.
And it's crazy. You know, I think this spotlight has kind of forced like, okay, and rightly so, females have a right to know what they're inserting into their body, right? Yeah. And if, you know, there's potential toxins and chemicals that could potentially cause harm later. We don't want to be fear-mongering either, you know. I think cost and affordability, accessibility is really important. And if you can only afford tampons and pads, that's what you're going to use. Right now, there is not enough evidence to suggest that they will cause harm. So, but like I said, those studies are really important. So we just kind of wait and watch. In the interim, there's like menstrual cups. There's this period underwear, which is fantastic. Yes. I've ordered some. I'm waiting for them to arrive. I'm, excited to give them a try.
Do you know what I love is so my daughter will never know the fear of leaking at school.
Oh, that is the worst. I've been picked up so many times because that's happened.
Do you remember like tying your jumper around your waist, or like having one of your girlfriends come up and be like, oi, there's a little bit on the back of you. Like my daughter will never, because she'll have period underwear.
Yeah, so good though.
That is excellent.
It's so good.
But as far as safety goes, at the moment we know that what we're using is relatively safe.
Yeah, that's right. And I think it's important that organic doesn't always necessarily mean free of chemicals. If I had any advice, it would be just to go for the fragrance-free options.
Oh my God, there's one in America that's been getting a lot of airplay on social media. It's like infused with menthol. Like, can you imagine the burn of a pad that has menthol on it?
Your vagina is not a flower. It doesn't need to smell a certain way. That's crazy.
Okay, next we're going to talk about something like this is, like, it's a bit gross.
Yeah.
But it's a common thing for most of us.
Yeah.
Please explain to me why period poo is a thing. And if you don't get period poos, it's literally like the week before, it's like your guts go crazy and they're like just wanting to expel everything that's in there. What is happening?
I feel like it's colonoscopy prep.
It is almost 100% like colonoscopy prep. If you've done prep.
Yeah, honestly, I think they should schedule all colonoscopies for females after their period.
That makes actual sense.
So basically the understanding is it all goes back to prostaglandins. So they're released, they cause the uterus to contract, they act on the smooth muscle. They also act on the smooth muscle of the bowel, so causing the bowel to contract, and then comes your period poop. So hormonal fluctuations with progesterone also play a role. So we know when progesterone is high, you're more likely to be constipated, and that's generally before your period. And then when it drops, the period poop comes.
So it's been held back for a while and now it's like, I'm free.
And then add the contractions as well. It's all happening. And we also know that the progesterone rise before the period is like kind of what triggers that, like craving for those sweet and carby foods.
Oh, so we're eating crappy foods.
You're eating
too.
crappy foods. And that's what causes those. I don't know if you get those pesky period farts that just smell. My husband knows. He'll be like, yep.
It's coming.
It's coming.
If your girlfriend, wife, partner starts like letting out some pretty nasty smells, you can almost be guaranteed the period is not far behind.
Yeah. So if I have general advice for females who this, is bothersome for, it's generally keep up your fluid intake. If you're losing a lot of fluids, you want to replace those electrolytes. Eat food high in fiber, fruit and vegetables. You want to avoid stimulants like coffee, processed food, chili. Try to avoid those processed foods, but if you need it, just eat it and you'll have a pesky fart here and there. That's fine. We're all human.
We also need to be happy.
Yeah,
and sometimes
that's right.
that means chocolate.
Yeah.
Sorry. Why is day 2 always the worst?
So this is when prostaglandin production is at its peak. So you're getting those intense cramps and, it's all happening.
If there's one request that goes around the Mamamia office most frequently is like, does anyone have a heat pack? Why does a heat pack, wheat bag, hot water bottle on your abdomen, why is that helpful in your period?
So the heat pack increases blood flow and oxygenation of tissues, so it acts like a muscle relaxant and helps relieve those cramps. And like studies have suggested it's just as effective as anti-inflammatory. It's also like thought to like desensitize like the pain as well and block that pain signal as well.
Is that like a very low-tech TENS machine?
Yeah, like a low-tech, like a cheap TENS machine essentially. Yeah.
Okay, that's interesting. I would like to know why I am so damn hungry when I have my period, because like I'm trying to be good and eat healthy and I'm trying to like do the best for my body and fuel it in a way that I think is going to, be the best outcome. But all I want to do is just consume, and it doesn't even really matter what it is. I just want to eat food.
So as your body prepares for menstruation, like your basal metabolic rate goes high. So you're actually using more calories and you need more fuel. So that's why you kind of have that increased appetite. And hormones also have a part to play as well. So during ovulation, when your estrogen is at its peak, it's like your appetite is reduced a little bit. But when it's down, you get a bit more hungry. And the same can go for progesterone, but it's the opposite way. So during that follicular phase, which is, the luteal phase, which is right before your period, you get a progesterone rise. Your body's preparing for that pregnancy. It doesn't happen and then it drops. And then that rise and drop kind of contributes to you getting those like hunger and wanting that carby and processed food as well. There's also some evidence which suggests that the fluctuations in hormones affect your neurotransmitters like serotonin, the feel-good hormones, and that low serotonin makes you want those bad foods. You eat those bad foods and then you feel like shit.
So partners, bring us a box of tissues and some chocolate.
And then you know what? You're not
and then leave us alone.
Yeah. And then you're not sleeping well, and that just kind of aggravates the whole cycle as well.
Can other things be impacted by your period? So, like for a while there, I would get my period and then I'd get a UTI directly after it. Like, can it impact or like have a knock-on effect and cause other things?
Yeah. So the fluctuations in the hormones. So when estrogen rises and estrogen drops. So we know when estrogen rises, you're at increased risk of thrush, and when it drops, you're at increased risk of UTIs.
Right.
Fun.
Fun roller coaster that is.
Yeah. And the hormonal shifts have massive impacts on your mood and quality of life. For people with PMS and the more severe form, PMDD, that can impact, obviously, relationships, your work, and everything around you. And we also know that the rise in prostaglandins, especially at day 2, can cause significant cramping, and that can cause you to miss like extracurricular or sporting. And the hormones also affect your temperature, right? And that temperature affects can disrupt your sleep. So there's, especially people with PMDD, they can suffer from like insomnia, and
that's rough.
And that sleep deprivation has that knock-on effect as well. So and then the skin changes, for people who get like hormonal acne and dry skin. It's not just all about the blood. It's got effects everywhere.
Fun.
Yeah.
Okay, this is going to come up quite often as we go on this adventure with Well. And it's not always a topic that a lot of us feel comfortable with, especially those of us who've been overweight in our time. And it's often been the one thing that we're told is the answer to everything is just lose weight. But does your weight impact your period and your cycles?
It does. So definitely. So changes in your body weight, whether, you're overweight or underweight, can impact your menstruation cycle. So if you're underweight or you exercise intensively, you may have an underlying eating disorder. We find that there's an estrogen deficiency, and that can cause irregular or absent periods as a result. And then we know that people that are overweight, they're more likely to have heavy menstrual bleeding, irregular periods, more likely to have underlying conditions like polycystic ovarian syndrome, and sometimes they might not ovulate at all. And that's generally because extra fat produces estrogen, which can disrupt that cycle.
I also saw another post from someone who said they were a nutrition scientist, but they claim that taking vitamin D supplements can actually help with period pain. Is that true?
So there is some evidence that it can help period pain, though in a lot of the trials, they were using really high doses, so well above the recommended range of normal. Vitamin D toxicity is very rare, but I would just advise anyone who wanted to take vitamin D, get your levels checked. If you're deficient, definitely start treatment, and always speak to your doctor before you're starting any supplementation. A lot of these medications can interact with other medications, and some medications, if they're used outside of that recommended range, can cause toxicity. Although vitamin D is very rare in that regard, you should always speak to your pharmacist or doctor.
Okay, and just finally, I got served this article via Instagram about how PMDD, which you've mentioned a couple of times, which is like extreme PMS, that people who have been taking these new range, or not new, they've been around for a while, but they're kind of new to us, range of weight loss injectables, so GLP-1 agonists or semaglutide, that is actually been helpful for PMDD. What do we know about that?
So there's very limited evidence for that, and I would definitely not recommend it to someone who has PMDD. We have evidence for medication that we know that works. We also know that some people report increased anxiety, depression, suicidal thoughts with these medications. So, what works for one or two people might not work for the general population. We'd have to wait till proper studies are conducted. And so I would always trial the medications which have been tested and tried, and that's generally go with your doctor. Yeah. Okay.
Well, now that we've learned a thing or two about how our internals are working, thank you, Mariam, how do we now take the things that we've learned today to make sure that we're explaining to our healthcare professionals what's actually going on? Because often with things around periods, we're told it's normal. And as you've mentioned, some people are just like, that's my version of normal. Feeling pain is normal. If, we need to take it to our GPs, how do we make sure that they understand that we feel like it's not normal, and what language can we use to help them understand that?
Definitely. First of all, I say it goes both ways. So like some people will think that their pain is normal or their heavy flow is normal, and will have, or some people think it's not normal, and I've seen a doctor and the doctor's dismissed it. And for those females, I'm really sorry, because if you think it's not normal and it's affecting your quality of life, then it fits those definitions. I strongly encourage any person who feels that they have symptoms that aren't normal. That Jean Hales is a fantastic website with a lot of information, and they also have like a period diary with a symptom tracker. And for 2 cycles, I would just encourage females to like kind of plot what's happening in terms of their flow, their passing clots, the symptoms that they're feeling, and take that information to the doctor, right? Because you're like, I've plotted this, I've done the work, and write down all the questions that you have as well. The worst part is when you leave a doctor's room and you're like, crap, I had such an important question to ask. And make sure you find a GP with a special interest in women's health. You know, a lot of the time, you know, you'll go see a GP and they'll be like, oh, yeah, you're right. But you find these GPs, usually their bios are up and it says, you know, I have a love for women's health. That's the doctor you want to see. You want to set aside a good amount of time to have this consultation with them. And during that consultation, the doctor will ask appropriate questions about your periods, how they're impacting your quality of life, maybe questions about, you know, when you got your period and how it's been and your family history. And then they should organize appropriate tests and imaging and potentially referrals if appropriate. But you shouldn't have to suffer in silence. Get that period diary. That information is so valuable. Write down those questions. Find that appropriate GP and and hopefully you get some answers.
Thank you. I think this is some big lessons we're going to learn here today is how to arm ourselves with the right information and the right tools to actually be heard. Look, next, we're actually going to be heading into the doctor's office. We're going to get some advice on a dilemma that Elise sent in to see if we can help her with her slightly smelly problem.
The doctor will see you now just through here to consult room 1.
First of all, seeing as this is our very first one, can you bring us into the consult room the way that you would bring a patient into the consult room?
Definitely. So I always start by saying thank you for waiting.
All right.
Yep.
We have been officially welcomed into the consult room. I love it. So this is where you can have your health concerns heard. So if you do have something you want to ask Dr. Mariam or any expert in the health space, make sure you reach out to us. You can send us an email, well@mamamia.com.au, or you can leave a voice note. You can find a link on how to do that in our show notes. So Elise recently reached out to us to ask this question. I don't think my vagina smells right. It has a sort of fishy smell, and when I wash it, I notice only an hour or so later it smells bad again. The other night, my girlfriend commented that it tasted different and I was mortified. Am I just not cleaning properly? Could this be a sign that something's wrong? Do I need to see a gyno or is a GP okay? Thank you so much. That's a really tough question to put out there into the atmosphere, so we really do appreciate you doing this. But Mariam, what should she do?
So I'd start by saying you don't need to see a specialist. Your GP should be your first port of call and they should definitely be able to get to the bottom of it. No pun intended. So basically what we do is we gather a bit more of a history, see if she's got any other symptoms like bleeding in between her periods, any vaginal discharge, or is it just the smell? I'd want to get more of a history about her cleaning her vagina. Is she using fragrance products? Is she inserting anything into the vagina?
Yeah, because I see a lot of these around. There's wipes and douches.
Yeah, you know, the vagina is self-cleaning. You don't need to use these products. And the fact that, you know, there's this expectation that our vagina should smell a certain way is just absolutely stupid. And by using these things, we can disrupt the pH balance of the vagina and it can cause infections like thrush. So I'd want to explore more of that with her and see if is she over cleaning it or inserting it, which potentially could be causing. We also want to exclude things like foreign bodies. That's a thing. Retained tampons. That happens.
Yeah, okay. I've had friends who've forgotten.
And it happens. It happens. Like females, we're busy people, you know. You could just push a tampon in and it's pushed the other one further at the back and you've completely forgotten about it. And then you want to exclude infections like bacterial vaginosis, thrush and STIs. So definitely first port of call is seeing a GP. They'd gather more of a history. They'll do an examination and take some swabs and they'll do your cervical screening test. You can also do a self-collection now, guys. That's a thing. So if you're late for your cervical smear, please do it. It's so easy, the self-collection. Depending on what I find during examination, I might commence treatment if I suspect it's bacterial vaginosis prior to the results coming and then follow up with the results.
It'd be so hard not to over clean when there's a smell.
Yeah.
Because we all know the smell of our own vaginas and sometimes it's worse at times. Like we all know about swamp crotch after going to the gym, or there's what's referred to as cabin crotch after you've been on a long flight. It can get a little, steamy, and I've heard someone refer to it as when you go to a nightclub bathroom
my goodness.
and it smells like hot muff. So
I love it. Oh my goodness.
So we know that at times that it can get a little bit much. And it is really tempting to then go in and just do a super thorough clean. But you reckon just be careful.
Yeah, so you don't need those products. Honestly, just warm water is more than enough. You don't need to be aggressive. You don't need to scrub and insert soaps. It will just cause more harm than good. Honestly, that stuff is just marketed. And it's in a way, unfortunately, that makes us think our vaginas need to be flowers, and they don't. It's normal to have a natural odor here and there. That's, part of our body.
Thank you so much for joining us on this very first episode of Well. Again, if you have any questions about what we discussed or any health concerns you want us to look into, make sure you shoot us an email, well@mamamia.com.au, or you can leave us a voice note. And if you're interested in exploring these topics and more, make sure you sign up to the Well newsletter. There's a link to do that in our show notes. And as always, the advice you've heard here today is general and may not suit your exact needs. So make sure you reach out to your own doctor or health specialist to get the info that is 100% right for you. And we'll see you for your appointment this time next week.
Bye. See you next week.